Hi, we are group 271 and today we are going to be talking to you about hand, foot and mouth disease. Hand, foot and mouth disease is a common viral illness that predominantly affects children below the age of 5. This viral disease is highly contagious as it can be easily transmitted via respiratory droplets, fecal matter, contact with blister fluid or general close contact with infected individuals. Adults too can catch the virus as it is often severe and clinically atypical, resulting in severe symptoms such as a high fever and intense edema, and can often be fatal. Hand, foot and mouth disease is an airborne disease which rapidly increases the rate at which the virus is being spread. The cause of hand, foot and mouth disease is a combination of two viruses, CA16 and EVA71. These two causative agents are the most common pathogens found in humans. These viruses would cause a change in the individual's cell morphology and function, which in turn compromises the immunity of the individual, giving rise to the signs and symptoms of hand, foot and mouth disease. Common symptoms include tiny blisters in the mouth, palms of hand, buttocks and soles of feet. Common cold symptoms, fever, runny nose and sore throat are also symptoms of children with hand, foot and mouth disease. The more severe symptoms than those mentioned can be vomiting and diarrhea, but are less frequent. More severe cases can cause serious and sometimes life-threatening symptoms, including seizures, encephalitis, pneumonia, meningitis, and complications with the central nervous and cardiovascular system. Human enterovirus A71 causes the most severe symptoms and has the highest mortality rates of the enteroviruses. If the disease is diagnosed and treated quickly and effectively, severe symptoms can be prevented. Q et al. 2015 stated that since 2008, 500,000 cases of hand, foot and mouth disease have been reported, with 176 of those cases being fatal. There are no anti-hand, foot and mouth disease drugs available. Treatments advised by a doctor to patients target the symptoms rather than the disease itself. Studies have shown that using Chinese herbal medicine in conjunction with Western medicine, such as a herbal injection, speeds up the healing time of blisters in the mouth, which is an advantage for the patient. Over-the-counter drugs are available for purchase, such as topical ointments which can reduce the inflammatory response of irritated skin and ease any formation of blisters. Pain-relieving medications such as paracetamol or ibuprofen to relieve fevers and mouth sores, and lozenges to ease an aching throat. A cost-effective way of treating symptoms is keeping hydrated and avoiding sugary and acidic drinks that may cause irritation. Maintaining a good personal hygiene is another way. In most cases, hand, foot and mouth disease will go away without treatment in approximately 7 to 10 days, as it is usually a mild disease with no long-term adverse effects to the patient. Hand hygiene plays a huge role in preventing the spread of hand, foot and mouth disease because this disease is more common in children, transmission is rapid and widespread because hygiene is not yet a habit. Teaching children to wash their hands after using the toilet, coughing and before eating food all play an important role of minimising transmission. As caregivers at home or in a child care facility, good housekeeping practices like wiping down toys, objects and surfaces that are shared amongst children can reduce the spread of hand, foot and mouth disease. A GP is an example of a healthcare professional involved in the treatment of hand, foot and mouth disease. They are the primary contact with a patient. They diagnose symptoms, provide education and prescribe appropriate medications. A pharmacist is another healthcare professional who dispenses the medications. Thank you for watching our video. I hope you learnt something on hand, foot and mouth disease. Bye.